Welcome, everybody. We're going to go ahead and get started. We have a few more people trickling in. So, hello. My name is Jennifer Westerholm, and I'm so glad that you are joining us this afternoon. Happy Friday. I work for Department of General Services in our Sustainability Division. Several of my General Services staff colleagues are here today joining us as well. I want to give a shout out to Jackie DeQuattro, who's our intern and is going to be helping me with tech support throughout today. And I also want to give a shout out to our esteemed tour guide, Brian Todd. Brian, give us a wave. There he is in the red shirt, who's going to be taking on us on this adventure today. So MetroConnect, if you don't already know, is a program brought to you by Metro General Services and Metro HR. This is our 4th year of bringing you this citywide program. It's tours of city facilities and programs that are innovative and sustainable, that are led by city employees for city employees. So we're really thrilled to offer you these tours this year, both virtually and in person. And it's going to be great. Virtual is always a little exciting, but I think everything's in place and we're all a little bit more familiar now with virtual technology and WebEx. So to give you a sense of where we're going today, I'm putting in the chat right now kind of our agenda for the day. So we're going to meet for 1 hour. We're going to be respectful of your time and right at 3 or a couple minutes before. We're going to start with introductions, some small group breakouts, the tour itself, which is pre-recorded video, live Q&A with Brian Todd, and a quiz. So pay attention. Want to ask you to participate. You can chat like we've been practicing. You can also unmute and speak during the small groups and the question and answer portions. And if you're not speaking, please mute just so that there's no background noise. And please keep your camera on if you can. If you have a camera, keep it on. Part of MetroConnect is connecting us. So seeing your smiling face is a great way for us to be able to connect and put faces to names. And very important, if you experience any technical questions, you can see in the chat, that is Jackie DeQuattro, our intern's cell phone number. She has graciously provided it. So if you have any questions or need help or something's not working, you can text 207-232-4384. So with that, let's get started and welcome everybody. I'm gonna share. Let's get this. Okay. So here we are a few years ago, MetroConnect all together. We're not necessarily in this large of a group now, but again, MetroConnect is a way of engaging Metro employees, and we're so glad that you all have joined us today. Again, just to emphasize, for tips for a smooth virtual tour today, turn your video on if you can, mute yourself when not speaking, participate. You can comment in the chat, you can ask questions, and we have a quiz, as I mentioned. And please note too that this event is being recorded so that your colleagues who couldn't be here today can watch at a later date. Once again, this program is brought to you by HR and General Services. And the program I run in General Services is called Socket. This is Socket the dog right here. It's our outreach and education program around sustainability for the Department of General Services. So a little teaser here about the Public Health Center where we're going to tour today. It was originally built in 1958, and Lentz has been providing services for the Nashville community for over 60 years. In 2014, a new 106,000 square foot building created a sustainable, accessible, and healthy home for Nashville's public health services, including both administrative offices and clinics. In recent years, Lentz has been the nerve center for Nashville's pandemic response and much more, as you're going to find out. And then I want to introduce you to our tour guide, Brian Todd. Many of you may know him. Brian joined the Metro Public Health Department in 1996 as the department's first public information officer. He's responsible for the development and implementation of the department's integrated communication program, and there's many facets to that. He provides strategic communications input as a member of the department's executive leadership team, and prior to joining Metro, Brian enjoyed a successful career in private sector public relations.
Hi, I'm Brian Todd. I'm the Public Information Officer for the Metro Public Health Department. Here at the Health Department, our mission is to create healthy conditions for everyone in Nashville and Davidson County. Today, we're going to take a tour of this building, which is opened in 2014. It's actually a LEED silver building, so there are a lot of sustainable features. We're also going to review some of the programs that we offer here at the Health Department. And a few stops along the way will be our environmental health, occupational health, public health emergency preparedness. And so we'll see those along the way, and we'll stop, chat a little bit, and learn a little bit more about the Metro Public Health Department. So let's go.
I'm Hugh Atkins. I'm the Director of the Bureau of Environmental Health Services at Metro Public Health. And our Bureau has several environmental programs: air quality, we have environmental engineering, food and public facilities, pest management. We have the vehicle emissions program in our group. And we conduct a number of inspections and collect a large amount of data every day. Our air monitoring folks collect data and compare it with the national EPA ambient air quality standards to make sure we're in compliance with those. And when you see an air quality alert for a day, those alerts are based on data that our staff here at Metro Public Health collect. They also issue permits for demolition and construction projects that may generate some air pollution. The Food and Public Facilities Group is probably our most visible group. They conduct food service establishment inspections, which you think of as restaurant inspections, but they also conduct inspections at school cafeterias and daycare food, and correctional institutions that serve food get inspections from us as well. And another thing that kind of gets lost in all that is food trucks and temporary food events like street fairs and festivals that have vendors serving food. Those groups get inspected by our food and public facilities folks as well. They do public swimming pools, hotels and motels, tattoo parlors, body piercing establishments, daycare facilities, and some correctional institution facility inspections as well. Our environmental engineering group reviews all the plans for new public swimming pools. They also have the subsurface sewage disposal program, which is the septic tank and field line for those that aren't served, homes that are not served by a public municipal sewer. That group also has an engineer that works a Legionella investigation group and also maintains a database of cooling towers in the city, since they are such a large source of Legionella outbreaks if we have them. We have a group called Pest Management that does a lot of surveillance, sets traps around the county at strategic locations collecting mosquito specimens. They bring the specimens back in here to the pest management lab and identify the species and send certain ones of those to the state lab to identify them and also test for West Nile virus and St. Louis encephalitis. If we have mosquitoes that are positive for West Nile virus, they then collect data on the neighborhood and send information to the residents of that area to inform them that West Nile has been identified in their area and that they need to take precautionary measures to eradicate mosquitoes in their yards and to wear protective clothing when they're out, especially at night when mosquitoes do most of their feeding. Another program we have in environmental health is the vehicle emissions program. Everybody has to get their vehicle tested. If their test turns up that they have an emissions problem, they can schedule an appointment over here and also get some advice from our staff here on what the results of that test mean and a ballpark figure of what a repair might cost when they go to their mechanic to get their vehicle tested. Another large part of the Bureau of Environmental Health Services is Metro Animal Care and Control. They do a great job of, as the name implies, animal control, but also animal care. They have programs in place to foster adoptions of pets out to families. So we cover a lot of environmental programs here in this bureau and stay really busy doing that.
My name is Rachel Franklin. I'm the Bureau Director of Communicable Disease and Emergency Preparedness here at the Health Department. The major role of the CDEP Bureau in the Health Department is to investigate those diseases that are communicable or contagious. So in the state of Tennessee, there's about 115 illnesses that if one of our residents gets one of those illnesses in Davidson County, they report it to the Health Department so that we can do follow-up, whether it's an interview with someone, seeing where they may have eaten, see who they may have exposed, to prevent public health outbreaks and emergencies. These types of illnesses include sexually transmitted diseases, tuberculosis, those diseases that are vaccine preventable, and all the other diseases like your salmonellas, your Rocky Mountain spotted fevers that are caused by bugs. Those are the types of diseases that we research and investigate in the Communicable Disease Bureau to make sure that we don't have a lot of outbreaks in Davidson County. Obviously, one of the things that we're really focused on right now and falls within our vaccine preventable disease area is COVID-19. Obviously, we've been fighting COVID-19 since winter of 2019. We have given over 100,000 tests here in Davidson County. Currently, you can get tested at one of 2 drive-through locations. Getting vaccinated is the best tool we have to fight COVID-19. It is proven safe and very effective to keep people out of the hospital, even if they do get COVID. It also is helping to prevent deaths from COVID. We encourage wearing masks when you're indoors, but the most important thing is to be vaccinated. We offer the Pfizer 2-dose vaccine and the 1-dose Johnson & Johnson vaccine. So right now we're down here in our, quote, vaccine basement where we keep all of our vaccine that we give. That includes COVID-19 vaccinations and those other vaccines that we give in our clinic, such as DTaP, hepatitis A, and so forth. Our COVID vaccine is kept at very, very cold temperatures. That's what these freezers here are. For our nurses to pack up the Pfizer vaccine especially and transport it to other locations, they have to put special cold gloves on before they reach into this. Right now, this freezer is at negative 76 degrees Celsius. So that's very, very cold. We have a very thorough procedure for checking out the vaccine, making sure that we write down what lot number it is, what the expiration date is, in case that particular vaccine needs to be followed up on. Everything is very detailed. We have someone that comes down here 3 times a day to check the temperatures. And on the weekends as well, we have an alarm system 24/7 that is triggered if any of these refrigerators or freezers should go out of the temperature range that they're in, because we want to guarantee that the vaccine that we give to the public is going to work and hasn't been jeopardized in any way. So that's what happens in this room.
Here we are on the third floor, and we're going to talk a little bit about what is available and accessible in our lobby. We designed the lobby to be friendly and welcoming. That includes where we have clinics, a sexual health clinic, a tuberculosis clinic, but when you walk into the Lentz Health Center, you don't see those names. What you see is suite numbers, and that is for privacy reasons. So when you're going in and out of any one of those clinics, it's just a suite. It's not an actual name of a clinic. You'll also notice the stairwell is the first thing you see when you enter the lobby. Even though we have elevators, the stairwell is the most welcoming, and it encourages good health. The design is actually for the building is a healthy building design. And speaking of the building, here are a few of the sustainability and sustainable features of the Lentz Public Health Center. We'll start by talking about, a lot of people ask, do we have a green roof? We actually don't, but what we do have is a rain collection system on the roof. It goes into a 10,000-gallon cistern, and that cistern is what waters all of the landscaping around the building. That's just one of those features. Another feature you'll notice, and you've noticed when we were downstairs, is a lot of natural light. That's another warm and welcoming type of feature for the building. Then you'll also see, when you drive up to the upper parking lot, an electronic vehicle charging stations are available there, as well as our electronic vehicles that the health department uses. Those are some of the features, and it's also from a healthy design feature. Where I'm standing right now is a walking track. It's an indoor rubberized walking track. When you make a full loop around, it's 1/8 of a mile, and it is very common that you see people on the track having walking meetings. And again, this is part of healthy building design. Not only are you seeing a walking track indoors, but also on nice days, we have a 1/4 of a mile walking trail around the building. And that's something that is very frequented not only by our employees, but by some of the folks that live nearby.
Hello, my name is Joanne Shaw. I'm an infectious disease physician here at the Metro Public Health Department for Nashville-Davidson County. In this position, I oversee Part A Ryan White program, the tuberculosis elimination program, and also our sexually transmitted diseases outreach program. For Ryan White, we provide funding for people infected with HIV and AIDS who are unable to afford medical care. And the Ryan White program covers medications and outpatient services. With the TB elimination program, we provide treatment for patients who have active tuberculosis here in Davidson County. Per law, we're the only healthcare facility that can provide treatment for those with active TB. We also evaluate and provide treatment for those with latent TB. That's those who have a positive TB skin test or a positive blood test showing that they've been exposed to the virus and are interested in treatment. We also provide consultation throughout Davidson County to healthcare providers who have questions regarding tuberculosis. With the Sexually Transmitted Diseases Outreach Program, we provide counseling and assistance with getting into the clinic for treatment and evaluation of those who have been diagnosed with a sexually transmitted disease, or they are contacts to someone who have been diagnosed with a sexually transmitted disease. We go out of our way to make sure we can get people into care, and we also provide early intervention services for people who have been recently diagnosed with HIV, AIDS, or they have been out of care for quite some time. And we work closely with our clinic colleagues to identify those who are at risk for acquiring HIV and refer them to our HIV PrEP program. Thank you.
My name is Diana BusbySoto. I'm a nurse practitioner and a clinic manager and provider for Occupational Health and Wellness Clinic, which is occupational medicine for the health department. We do physicals for pre-employment for Metro employees, and we also do yearly, annual, what we call fit for duties or physicals for our fire, police, and EMS services. We are a broad kind of physical in that we don't just do head to toe, we also do testing for hearing, vision, and EKGs. We also do a full inclusive lab work if it is needed, and then we kind of gear the physical towards what the job they will be doing. And we have a list of that, of what the job is and what their job title will be and their job specifics. Because in part of doing their physical, we're not only making sure that they are safely able to do their job, but they're also able to keep their civilians safe and their team safe as well.
Well, that concludes our tour. I hope you've enjoyed the trip around the Lentz Health Center. I hope you've learned some of the things about the sustainability of our building, as well as some of the programs that we offer. For more of that kind of information, go to our website, health.nashville.gov. There you'll find A through Z, all the programs that we offer. Thank you for having me, and good health to everybody.
All right, that was awesome. I want to say a big thank you to Brian, as well as his health center staff, Dr. Franklin, Dr. Shaw, Dr. Atkins, and Ms. BusbySoto, all who appeared, and then everybody else who helped us learn so very much on our virtual tour of Lentz. So now we have a great opportunity to actually talk live with Brian Todd, who you met in the video. He's here with us on the WebEx meeting. So we're going to take 10, maybe a few more minutes, and invite you to unmute yourself and introduce yourself. Please just name and department, and ask Brian a question. He's happy to field any and all questions. He's very used to that in his role as Public Information Officer. So he's ready to take your questions, and invite you all to jump right in. Just unmute and ask Brian whatever's on your mind.
I think we've blown them away, Jennifer. So is there any question that you have about COVID? Because we've been dealing a lot with COVID, about vaccinations. Are you aware of where the vaccination locations are and what's required, or anything about the new information that came out this week about the FDA's approving the 5 to 11-year-olds? Any of those kinds of questions?
So I don't necessarily have a question about COVID, because I know where the vaccinations and everything is, and where it's available and all that good jazz. I do have a question about some of the services that were mentioned. with just the services as far as like TV and all the other services. I posted into the chat, but I was wondering, is there a pre-qualification requirement for those services, or just anybody can walk in and get help with that, the different health options, or how
You know,
does that work?
that's a great question because there is no pre-qualifications, and many or most of our services, well, for example, the COVID shot itself, there's no cost for that. Um, we do have certain costs. One is for children's immunizations. If somebody needs the MMR or the varicella, we will bill those based on someone's ability to pay. But as far as like, for example, tuberculosis, um, we want to make sure that there are no barriers because the overall health of the community is important. And if you have somebody who feels like they may not be seen because they couldn't afford to receive the treatment, then that puts more of the community at risk. So for that reason, and many others, just for the health of the community, there are no pre-qualifications, and especially for TB costs.
Awesome, thank you.
Hey, Brian, this is Nate Ellerman with Metro Water. I have a question for you.
Go ahead.
I was curious about your air quality department. Do you all monitor everything within Davidson County? How often do you sample? And I was just curious if you could talk a little bit more about that.
Sure, that's a great question. Yeah, one of our larger environmental health programs is air quality. So we are for Davidson County, and we're responsible for monitoring the air based on EPA standards.
Okay.
We have air systems, monitoring systems. If you were watching the video a few minutes ago, Mr. Atkins was actually standing in front of one of the air monitors. That was one that was being worked on, but we have them on top of area schools, on the Percy Priest Dam. We have them spread all over the county, and we continually monitor those. And we're looking for a lot of different types of air pollutants, one of which, especially in the spring, summer, and fall, is some of those are that could cause people who have asthma, heart disease, or might be at risk. Then we will put out an air alert, and when we do that, we do it on our social media platforms. We send the news release to media, and of course we put it on our website. And typically, if there's an air alert, that's the newscast it will be broadcast during the weather. Typically, is when that will be broadcast. But ozone is one of those particulates that are a problem. A lot of people hear ozone and you think of the ozone layer that protects us from the potential effects of the sun. This is actually ground level ozone that can cause people to have breathing problems, especially if you have asthma or any of those kind of chronic illnesses.
And Brian, it looks like we had another question about air quality. You may have responded to some of this, but Lydia with WeGo is asking about the data from the air quality data. Is it available to the general public or other metro agencies? They pursue a lot of projects with CMAQ funding, and so wanting to know if she can kind of analyze the connection between traffic and pollution and see those connections. So can you speak a little bit to that? Like how can she dig in there to the data and really analyze?
Sure, and that you just need to talk to Hugh Atkins, reach out to him, or reach out to me, and I'll get it to you from Hugh. I will say that it's a great thing to have mass transit, especially WeGo, because as you can imagine, when you have the growth that we've had in Nashville, and having interstates that, from 65 going north and south, 24 going across the state, and then 40, we have a huge amount of traffic that travels through Davidson County every day. And as Hugh would tell you, the number one source of air pollution in Davidson County is from traffic, is from gas burning vehicles. So that is something that also has, if you've been paying attention to some of the media reports, the state legislature has 2 years ago made it where that the contracts with the air monitoring companies would end and would no longer be part of an air program. And if you live outside of Davidson County, that contract with Opus, so it would be, for example, it would be those surrounding counties for Davidson County that require vehicle emission testing. Those would end on January 15th. For Davidson County, our contract actually runs through, I believe it's the end of June of 2022. There is some discussion at the council level that there may be an interest in extending that, but all that I don't believe has been decided.
Okay, I got a question. I keep on hearing, ever since I've been in Nashville, Lentz has been kind of the name on the building, and I assume that is a person, but I don't know anything about that person.
That's a great question. Dr. John Lentz was a physician, and he was the first Nashville Davidson County's first director of health, and he started in 1920. He retired and it moved to a different director in like 1962. So it's an amazing amount of time. But he was also really a forward thinker. Nashville actually was the first city in the United States to get the Salk vaccine. And if you know what the Salk vaccine is, the polio vaccine. We have a picture of Dr. Lentz meeting the plane with the shipment on it at the airport. So he was a physician. He was really critical at a time when, think about when he first started as the director of health, one of the top 10, really one of the top 5 leading causes of death was tuberculosis, because in 1920, they didn't have it. The only way to treat it was really fresh air. So you had these sanatoriums that were around that people would sit out and breathe the fresh air. And it really wasn't until the late 30s and early 40s that the antibiotics came on the scene, penicillin in particular, that was shown to treat TB. So he went from that being the leading cause of death to a lot of the changes that occurred just in Nashville in 40 years was pretty incredible. We had, pest management problems. We had rabies, and many people don't know why animal care and control is under the health department. Well, actually, Dr. Lentz made that decision back in 1945 because there was a serious problem of domesticated animals contracting rabies and biting people. So in his mind, that was a public health threat, and it's been under the health department ever since. But he was a very powerful guy, and he stood at about 5'2". And we actually, the Lentz family is still in Nashville. And when we changed from the old building to the new building, they were part of the ribbon cutting and everything. And as a gift to Metro, there's actually a bust of Dr. Lentz in our lobby that they provided.
Who on the meeting today went to the old Lentz and maybe got a shot or a vaccine? Raise your hand, show of hands. Yeah, me too. I very much remember going there as a kid and being poked in the arm. So the new center is definitely a huge upgrade. It's a lovely new building.
One of the things I was telling Jennifer when we were doing the tour, for those who had visited the old building, it was built in 1958. I pulled something off of the wall when we were leaving the building, and it was a fallout shelter this way. It was down the steps, and I thought, wow, that's that was the focus in 1958. You know, was that was our fear, if you will. Um, but the last probably 3 years that we were in the old building, we have a film school here in Nashville, and every fall I would get a call from students at that filming school asking if they could come over the weekend and shoot a movie. They were working on, that was their project, and I would ask them, is it a healthcare um, movie? I mean, is it a documentary about the, patient care? And they're like, every one of them, every single one of them was, no, we're working on a horror movie and we think that building would just be perfect for it. So it kind of tells you what it was like then. And of course, the building now is we're very proud of it.
Brian, another question came in the chat from Lydia. Does the health department have programs supporting the education of nutrition and whole organic foods?
We do, and it's primarily through our federal program. It's the Women, Infants, Children's program, and that's something that we do in supporting children from birth to 5 years of age, as well as moms that are enrolled in that program. We have about 16,000 people that we provide services to, WIC services to every month. But that is one that people think of WIC and they think of just the food part, but it's actually an education element as well on healthy eating. It's starting at, in infancy and trying to encourage healthy eating habits all along the way.
Great, we have time for probably one more question. Who has a burning question for Brian? If not, we're going right into our quiz. So you guys should buy yourself some time here with a question.
All right, I'll ask one last question since nobody else
Okay.
does. Does the health department partner at all with the school district at all?
We do actually. I was just on a conference call with them about vaccines, the COVID vaccines, if and when that becomes available to when the vaccine becomes available to us. But as somebody was saying, I can't remember who it was. Their daughter is a school health nurse, and so we do a lot. We have a lot of connections with metro schools, especially not only providing school nursing in the schools, but also nutrition education. And then, of course, we work really closely with them with any type of disease outbreak. You hear about norovirus. It seems like it comes up, it's a stomach bug that happens every year. So we work closely with them on just as far as care in the schools. And we're moving toward having a nurse in every school. We're not there yet, but we're moving in that direction. We'll be glad to get to that point where a nurse doesn't have 2 or 3 schools to cover.
Brian, thank you so much. Thanks for all your questions, everybody. That was
you.
great. And I'm sure that if you have additional questions, Brian will be happy to address them. So feel free to flood his email box. He's always looking for more work. He can either answer it or field it to someone in his department that could answer your question. So amazing breadth of services that Lentz and the other clinics offer. So really amazing. Thank you, Brian. And I hope you were paying attention during the video because now we have a little quiz. It's going to be a little competition here. So here's how it's going to work. I'm going to ask you to open up, and you can look in the chat here, open a browser. You can either open up a new tab on your computer or you can do it on your phone. and go to menti.com. That's the web address that you want to go to, and enter the code that you see there, 92726471. And you'll enter a name for yourself, and you are gonna get points in the quiz for correct answers, but also quick answers. So speed is going to be rewarded. I'm gonna share my screen so we can all follow along. Okay, so www.menti.com and enter in that code 92726471. And you'll make a little name for yourself. Okay, good. We got our players jumping on board. Everybody's got a little emoji assigned. And there's going to be 5 questions. So remember, you're going to get points for correct answers, but also quick answers. And there's a lot at stake here. The winner is going to receive some socket swag. We've got coloring books. We've got stickers. We've got custom water bottles, t-shirts. I don't know if you can see this nice t-shirt here. It's really soft. It's organic cotton. And tote bags. So you're going to get a deluxe package of socket swag. So if that doesn't motivate you, I don't know what will. Okay, I'm going to give folks like 10 more seconds to join, and then we're going to get started. Okay, here we go. Lentz earned which LEED certification for being an eco-friendly building? So look at your browser or phone and give your best guess. Oh, very good. Most of you were listening closely. That's right. Silver, LEED Silver. So LEED, Leadership in Energy and Environmental Design, an international standard for healthy and eco-friendly buildings, and Lentz is LEED Silver, which is a great distinction. Makes it a great place to work and to visit. All right, moving on to question number 2. Which is not a program of the Environmental Health Bureau? All right, very good. Okay, yep, soil management's not, but all these other ones, air quality we talked a lot about, food protection in public facilities, and vehicle inspection are all programs of environmental health. They do so much in that bureau. Okay, question 3, you still have time to redeem yourself, even if you've maybe gotten one wrong or been a little bit slow. Contagious diseases that Lentz monitors include all of the following except Oh, perfect. Great job, everybody. Everybody knew that one. I have a touch of laryngitis, so this one is personal. That's right. So laryngitis, not, but all the rest, yes. Very good. All right, it's going to be a tight race. Moving on to question 4. Get ready. The Pfizer COVID-19 vaccine is stored at Lentz at approximately what temperature? Very good. Dr. Franklin said it was -76 Celsius, which is quite chilly. It's got to stay really cold. So very good. Okay, let's see who's in the lead. Here's our leaderboard. Okay. Oh my, it's a tight race. Oh my, it looks like Rebecca is in the lead. Okay, Curry time. Okay, Randy Gannon, Kevin, you guys have a chance. This is your last question. Let's get it going. We gotta oust Rebecca from that top. Rebecca, hang on to your lead. Okay, here we go. Question number 5. The tension is mounting. Sustainable features at Lentz include all of the following, except very good. Yep. No green roof. Brian kind of threw us a curveball there. He's like, they think we have a green roof. We don't have a green roof. But EV charging stations, natural light, rainwater, got all that. Awesome sustainable facility. Okay, let's see who our winner is. Oh, Rebecca held on to her lead. All right. Congratulations, Rebecca. Amazing. If you want to email me, jennifer.westerholm@nashville.gov, Rebecca Moore, then I will figure out how to have you redeem your prize. Congratulations. Thanks for playing, everybody. That's really great. Good job. Well, we are going to wrap it up here. I'm so appreciative to Brian, Todd, and again, all of the other health department staff that helped make this possible. Thanks to you all for joining the meeting today. You were a great participants, so thank you so much. A few things. I do also want to give a big shout out to Metro Nashville Network. The beautiful quality of that video, the wonderful audio, the transitions, oh my goodness. Metro Nashville Network, Aaron Coles and his group did an amazing job with that. So thank you, Metro Nashville Network, for making this very professional and wonderful. So a couple things that I want to request that you all do before maybe you leave work for the day is we have a survey. It's here in the chat. If you take this survey, you can click on that survey link and just help us out by letting us know what went well and what we can improve for future tours. That would be really helpful. Also, if you have ideas on facilities or programs that we could visit in the future. Also this year, we have something new and exciting. If you follow that link, you'll see it's called a sustainability checklist. It's a 2-page front and back, quick, less than an hour checklist that you can take into your workspace, whether that's at home or in an office, and look at what are the opportunities for your workspace to be more sustainable, more green, and more efficient. There's categories like food, water, energy, waste, and you can check off what's going well and maybe what there are opportunities to improve in, and we will support you in making those improvements. And then finally, sign up for more tours. We have 4 more virtual tours, as well as some room in our in-person tours. So City Cemetery, Frankie Pierce Park, Fulton Campus, the MNPD Crime Lab, and Shelby Bottoms. With that, thank you all so much for being here, and we'll see you at the next MetroConnect tour. Bye.
Thank you. Bye-bye.
Thank you.